Hello, today is Tuesday, June the 23rd. I am Michael Ramone, your state representative with your daily report. The numbers are as followed. We're on the 104th day of COVID hitting Delaware, and we're on our 23rd day of reopening our state. We are now at 10,820 positive COVID tests in Delaware, 4,682 in Newcastle, and 85,903 negative results. There are 6,459 recovered patients from COVID. There are now 89 in our hospital. 17 of those are in critical condition. We have 435 deaths. 197 of those are from Newcastle, and 0 are from the 21st Representative District. Yesterday, we described the remaining legislative schedule, and we detailed our community report with all the things going on in our community, highlighting the opening of Paper Mill Road, so forth. It was a very good report from yesterday if you want to take a peek. Today, we will be summarizing the Division of Health and Social Services legislative update given by Secretary Walker and Dr. Rattay. But first, tomorrow is Wednesday the 24th, and then Thursday the 25th. We will have busy session days to attempt to close out the 150th General Assembly. We need to do that by passing our budget, passing our bond bill, and passing grant and aid. All three have been submitted by the subcommittees, and they will go in front of the House and the Senate. I will do my best to produce a daily report each day, although we will be going in caucus very early and then in session for most of the day. I may not be able to get both of those done. If I don't, and you do have any questions on what's going on or how you can participate or have knowledge, please don't hesitate to email me at themike@mikeramone.com or just call my cell, 584-8601. We will have a Friday daily report regardless of what happens on Wednesday and Thursday, and I will summarize everything that has happened to get to the point of closing the legislative session. Sunday, we will be having our first evening coffee. It will be at our home at 7 o'clock. We live at 211 Nathan Court. Many of you have been there in the past, and you're welcome to come again. Due to the Safe Space initiatives, this event will be outside, not inside, so we can spread out chairs. I ask everyone to please wear their masks, but I will have more to provide, and I will also be giving out hand sanitizer. If the weather is not cooperating, we will not be moving the event inside. We will be doing the event traditionally like we always do on Zoom. So if you want the information and we figure out on Friday or Saturday that the weather's not going to cooperate, we will send out a Zoom link to everyone. So if you would like that, please just send an email. If you're not comfortable with attending the outside event as we're going to do it and the weather is cooperative, send me an email. We're trying to figure out if maybe we could do this live like we did the event at the Oakland Valley Swim Club for the Tuesday morning meeting. It was we had over 1,000-something people that actually ended up viewing that. So that may be the way we go with that too. But again, remember, that won't be on Zoom. That would probably be on like Facebook Live or another caveat, but we will reach out and make sure you know that. The Red Clay School Board had their meeting last week, and a proposal by 2 of the board members was produced to eliminate the SROs in Red Clay and reallocate the funds to add mental health staff to the Red Clay School District staff. Your input about this initiative is very important to me. I'm not sure what most of the people out there think, especially if you have children at Red Clay, or even if you don't, whether the SROs are important to have or not, or whether that money should be redirected and how. So please send me an email, give me a call, whatever's easiest for you, and let me try to figure out exactly what we will be doing in that initiative to help make sure Red Clay School has the support they need from the legislature and from the community. Today, the Division of Health and Social Services legislative update was given by Secretary Walker and Dr. Rattay. It started with a statement about the increase of the 45 COVID positive cases and the additional 10 hospitalizations. This is the first uptick for a very, very, very long time since we met the top. It was up and down a bit, but once we started the decline, it was very consistent. The next was an update on contract tracing and using this data to report on the trends that we are noting. That's extremely important especially with some of the contagions that were found in the high school kids down at the beaches. Now bringing that back, figuring out where it's going, figuring out what the hot spots are, and those trends was all very, very important. Last, the secretary brought up that this may be the last legislative update, but they're definitely not having one next week, and they may not have them anymore. So I may not be giving any more summaries, but definitely there will not be a legislative update by the secretary next Tuesday. I'm not sure of the exact logic of that. I do know that the secretary, as I told you all a couple days ago, has announced her retirement, or not retirement, but she is moving to Washington to work for the Nemours Foundation, and that is a wonderful opportunity for her. And I'm sure we will follow up with more information on that as we get it. But I believe she is done in July, so maybe that's a reason why these meetings are wrapping up. The question and answer session then began, and those questions began with legislators asking, first of all, do we have ability to successfully contact trace those who are affected? And stated by the secretary and the doctor very affirmatively, yes, we do. We are learning how to do it. We're doing it better and better, but we do have the resources, the boots on the ground to get it done. Second question, are we rising as other states with a flare-up of COVID? It is notable that we did have an increase in the last day, but I don't know that that dictates a trend, but we are covering that, and we will keep everyone notified, and that is why we are doing such a heavy-duty job with the contract tracing. Next was, what about the people who are in non-compliance? Specifically stated was those not wearing masks. Some had mentioned rallies and protests. Others had said, media events and elections in the schools that we had. The secretary and the doctor both exclaimed that it is extremely important that we all must do a better job in compliance. I think that was meant to be not just us as the people out there wearing the masks, but as the government being consistent in what they're doing and the business sector continuing to be diligent in what they're doing. Have we completed gathering information? Have we completed gathering any data on daycares? Mostly, the doctor said we are collecting data from the high-risk settings, so therefore there isn't an active data collection effort going on right now in the daycares, but the doctor did acknowledge the representative's request and said would look into that being enhanced. Where is the climbing cases? The cases that were just defined, were they only at the beach? Were there other places? And they replied that it was mainly from the beach area. Once again, I had asked again about the numbers on the comorbidities and the COVID and the numbers of COVID deaths versus the COVID probable deaths, which are people who were never tested positive for COVID, but we classified them as a COVID death because we said it was probable that they had COVID. The doctor, once again, this is the 6th week, had stated that they're working on that. They will be calling me personally to try to find a path forward for that, viewing that we won't be having any more meetings. The next question was, does the warm weather enhance or detract from the protection from COVID? In other words, is it warmer and therefore we have less of a possibility of getting COVID, or more of a possibility? The doctor answered that there's just so much to still be learned. The technology is going to be helpful in learning a lot of this, but the technology really isn't quite ready yet. But there is just so much that we are learning and digesting to be able to handle this COVID outbreak as we keep getting bigger, better, and stronger in the future. The problem is nothing's actually ready yet. So that's about it for today. I'm asking 2 things: to please stay healthy and please stay safe.